Welcome to the Research Works podcast, brought to you in association with the Healthy Strides Foundation. Your hosts are Dr. Dana Poole
and Dr. Ashley Thornton, and we're here at the AusACPDM conference in Cairns, Australia, to interview world-leading researchers, clinicians, and people with lived experience
to support your practice in being more evidence-based.
We are back at the Research Works podcast, yes. As you can tell, we've been recording lots of episodes. We're day 2 of recording, and we're so excited to have Mahmudul Imam joining us on the desk today.
Yeah, welcome.
Thank you, Ashley and Diana, for inviting me to talk about my project. Thank you.
We're very excited to speak with you, and it is a busy lunch hour at the moment, but I think it makes it more fun.
I think it does too. You'll hear all the fun and frivolity and background noise as we have our chat.
Because everyone is eating their lunch, so hopefully it looks like a really delicious lunch, actually.
So, Mahmudul, you are a postdoc research fellow at the Global Cerebral Palsy Program of Central Queensland University in Australia and a senior epidemiologist, which sounds very impressive.
Very, very interesting. And look, what you're presenting a lot during this conference. Actually, so teeing up a time between us was actually quite challenging, wasn't it?
I have been presenting 4 presentations.
Wow, amazing.
And there's another one that I'll be presenting tomorrow in the morning, which is a PhD platform.
Yeah, yes, congratulations.
Absolutely.
Yeah, that's a huge one. So the title of that is Cerebral Palsy in Low and Middle Income Countries, Situation Analysis, Rehabilitation Status, Livelihood-based Intervention and Social Business Model.
Yeah, that's the one.
It's a mouthful.
Yeah. No wonder you have so many presentations. So let's get started. Can you tell us, I suppose, a little bit about your work and the context in which your work is happening?
Thank you for this opportunity. And let me just start with my PhD work that I did.
Yeah.
So I started with an innovative project called situation analysis. So we all know that there is a lack of services in the developing countries, low-income countries, but we don't know the magnitude. How many people are providing services? How many physios are there? How many OTs are there? How many speech are there? So that's why I conducted a situation analysis study considering the WHO 6 constituent, which is leadership and governance, service delivery, human resource, information management system, financing mechanism, as well as assistive devices. Wow. So what I found was quite astonishing, to be honest. So rehabilitation is not integrated in the mainstream health services or hospitals. It's not integrated within information management system or financing mechanism. It's not even included within the health policies.
Wow.
So it's being provided as an isolated project of social welfare department.
Wow.
So you can imagine the accessibility situation and other stuff.
Yeah.
So, and apart from that, I found that there are only 9 physiotherapists for 1 million people.
That's incredible.
Wow. So, which is 1 physio for over 100,000 people. And most of the services are located in urban setting. I would say 96% of them are located in urban setting, leaving only 4% for the rural setting, where the majority of the Bangladeshi population reside.
Yeah.
Wow.
And only 1% of the rehabilitation facilities has multidisciplinary services, including physios, OTs, or speech. So you can imagine the dire situation over there.
Yeah.
And also, most of the services that are available require out-of-pocket expenditure, and which is really tough for these poor families to get the services.
Yeah.
So that was really quite eye-opening for me to understand what's going on, particularly for the children with cerebral palsy.
Yes.
So then I did a population-based rehabilitation status study.
Right.
So I assessed rehabilitation status of children with CP and their predictors of rehabilitation service uptake, utilizing a population-based data. We call it Bangladesh CP register data. So let me just tell you that Bangladesh CP register is one of the leading cerebral palsy register based in LMICs. So we started, we are the pioneering pioneering CP
Yes,
register in
really
LMICs.
are.
Yeah, it's
So we
incredible.
started back in 2015 in a small sub-districts. The name is Shahjatpur. So we started from Shahjatpur. Now we are covering almost 18 districts of Bangladesh. So utilizing the back to my discussion. So
Yeah.
utilizing the BCP data, I tried to assess rehabilitation status of children with CP, and what I found was like quite astonishing as well. Like 50% of the children with CP never receive any form of rehabilitation services in their lifetime. And this is also not kind of overestimation, because we ask whether they have received any type of services in their lifetime. So it could be like a once in a lifetime service, like
Yeah.
one encounter in
Yeah.
their lifetime.
And still
so,
nothing.
but if I ask the question like whether they received any services in last 6 months or last 12 months, the proportion of the percentage might be less than 10%.
Yeah.
So this is the situation, and over 95% of the children who are at GMCS level 3 to 5,
Yeah.
who need assistive devices,
Yeah.
they never received it. They never received any kind of rehabilitation services. And in terms of like regression model analysis and predictor analysis, I found that like mother's education, poverty, and GMCS level, these are strongly associated with rehabilitation service uptake.
Yeah.
So that was the first study in LMIC
Yep.
to identify the predictors and to show the rehabilitation status of children with CP. So then I wanted to know about other LMICs.
Yeah.
So what's going in other LMICs? So
Yeah.
then I assessed rehabilitation status in Nepal, Ghana, and Indonesia, and I found that similar situation. Almost 50% of them never receive services, and there are like almost 50% of, or more than 50% never receive assistive devices, and the similar predictor in other LMSs.
Yeah.
So I thought like, what can you do?
Yes.
Yeah.
So I understand that there are lack of services.
Yes.
There are lack of professional.
Yeah. Yes.
And we cannot change it overnight.
No.
Yeah.
Like we cannot train a physio like within
No.
That's
one
right.
day.
Especially
or
when
one
you're
Right.
talking about
Yeah.
like 9 for how many people was it?
Yeah,
Yeah.
9
Million.
physio for 1 million people.
Yes, that's
And-
not a quick fix.
And
No.
if you consider speech, it would be 1 speech for 1 million people. So
Wow.
it's a devastating situation.
Yeah.
Yeah.
Okay,
So-
so coming back to
Yeah.
Yeah.
what can be
you
done?
do?
So
Yeah.
what can you do? So we sat with my principal supervisor, Professor Golam Khandokar, and we discussed what can you do like to improve their services, because we know now we have the data.
Yes.
Now we know that they are not getting services.
Yeah. What's
and
the
there is no
baseline?
professional to
Yep.
provide them services, particularly in rural setting.
Yeah.
We can get services in the urban settings because the like limited professionals are concentrated in urban setting, but there is no one to provide them services in the rural setting. So what can you do? Then we tried to establish a new model.
Okay.
So what we found analyzing the CPR data, Bangladesh CP register data, that even when there are services, people are not accessing those services
Okay.
because they have other priorities.
Yeah.
I see.
Most of them are day laborer. They cannot take their children to the center, like avoiding like income generating activities.
Yeah.
Wow.
So if they take their children to the center, they have to like miss their livelihood.
Yeah.
They will not be
Yes.
able to earn any income.
Yeah.
So they
Right.
cannot like take their children. So they have other priorities because of their
Yes.
poverty, because of their financial constraint.
Yes.
So we thought, what can we do? So then we designed a integrated livelihood support and community-based rehabilitation program for children with CP. And we applied for a project grant to CP Alliance.
Yeah.
And we found the grant, and we were able to conduct a cluster randomized control trial.
Yep.
So there were 3 arms. In the first arm, there were integrated microfinance-based livelihood support and conventional CBR or community-based rehabilitation.
Yes.
In the second arm, there was only community-based rehabilitation, and the third arm there was like care as usual. And after we started the project in December 2020, And as you know, that the COVID hit, so we had to change the protocol. We couldn't provide early intervention services. We had to like just follow up and educate the parents over the phone. We had to stop the services for about 8 months.
Wow.
But once the situation is a bit controlled, then we again started the services with a modified protocol. We provided home-based CBR services. And after analyzing the 12-month data, what we found that even after the impact of COVID, the IMCBR program, or Integrated Microfinance-Based Livelihood Support and Community-Based Rehabilitation Program, was effective in improving health-related quality of life and social capital of children with cerebral palsies and their families. So that was like quite amazing findings. And so we thought we should replicate this model, and we should think about any other strategies to improve the services. So we also designed a new model called social business model for children with cerebral palsy. So what we did, we established a center where there are 2 types of services. One is dedicated for the children with CP, which is early diagnosis and early intervention services, which is completely free for those children, because we know that almost 80% of them are ultra poor. They won't be able to provide any fees or any money to get the services. So we provided those services free of cost. And we also provided physiotherapy services for pain and paralytic condition. Basic physiotherapy services for pain and paralytic condition, or like knee pain or shoulder pain or neck pain. So this is just to generate some money, so that we can provide the services for the children with CP at free of cost. So we, after running the center for about 13 months, we found that the center was able to generate enough revenue to get a break-even point.
Amazing.
So that was another model just to improve the service accessibility and to improve their health outcomes.
That's so important for sustainability, right?
It is, absolutely.
This work has such significant impact. I can't think of anything there is more
it's hard to have
than,
other words,
than
isn't
this.
it?
But
Yeah.
the fact that it's not just for a short time. There's actually steps made to build in sustainability and make it sustainable and long-lasting is really powerful.
And you've come up with such a practical solution. I think the challenge sometimes is we can identify the problem. All the
Lots
time.
of problems.
We can identify the problems. And then the next part is the so what. So you did both.
Initially, when we just to be honest, we didn't had that idea we need to provide service or we need to conduct any interventional studies. Initially, we had thought we should. There is no data, so you need to get the data. So we collected the data, and we analyzed the data and we reported the data, and we found that there is higher burden of CP, which is 3.4 per 1,000 live birth.
Wow.
And 50% of them never receive services. So we cannot just sit alone and say, oh, we got the data, we published the data, so we're done. We can't do that. So we should, from ethical perspective, we should provide them some services. So from that point of view, Prof. Gulam Khandokar and I have another mentor, Professor Mahmudul. So together we designed these services. And I should tell about another service that we recently designed, which is called Smart CP model. So the model that I discussed earlier, Support CP, which is integration of livelihood support and community-based rehabilitation, and the social business model, those are not sustainable without external fund. So what can you do to make this services or make the model sustainable? So we designed a model called Sustainable Model of Early Intervention and Tele-Rehabilitation for Children with Cerebral Palsy in rural Bangladesh, or in short, we call it Smart CP. So as we know that there are lack of professional. So if we want to bring any professional to the rural setting, it would cost a lot of money. So it's not pragmatic. So that's why we formed a tele-rehabilitation team
Yep.
A centralized tele-rehabilitation team, including trained doctors, qualified physiotherapists, occupational therapists, speech therapists, and nutritionists who can sit in the like a central point in Dhaka, in the capital city, but they can provide services to the rural city. That's one innovation. That's one part of the smart city model. And what we also do, we also develop a referral network, a village-level referral network, including mothers of children with cerebral palsy. We call it Empower groups or Mothers Power Group. So this group met fortnightly, and we train them with a manual called Getting to Know Cerebral Palsy, so that they know how to take care of their children and they can get a safe place to discuss their challenges and their concern. So that's one thing. And we also form a key informant network is like by training community volunteers like teachers or religious leaders so that they can advocate for these children and refer those children. And we also established rural smart CP center or early intervention, early diagnosis center for children with CP. So that's the recent innovation that we did. And if we have some time, then I can elaborate about smart CP model, but I don't think we have the time.
No, I know. There's so much to go through. I know. I'm mesmerized hearing about it.
For a full episode,
I think we'll need to do that.
So much to cover, and we want to do it the justice of really delving into it, because it's so comprehensive and so thorough what you have done and what your team has achieved. You know, really meeting a need, and it's congratulations.
Congratulations. And you've given us a good taster of what it's all about. And we will definitely put links for your papers, and we'll have a chat to you again really soon. So thank you so much for coming on the podcast today.
We can see why you've been so busy.
Just to conclude, I would like to state that from the global CP program that I work on, we have a register called, we don't call it a register, we call it a network. Global LMIC or low and middle income countries CP register. It's a network for all CP register based in low and income countries. And we have a website, www.gncpr.org. So if any countries or if any collaborator or if any researcher wants to develop their CP register in low income countries, we provide seed funding. We provide training how to establish this register. We provide all sort of support to get the data, to train the local people, to collect the data and to analyze the data and publish the data. So please feel free to join the network and help us to visualize the data and visualize the children with CP residing in low and middle income countries.
Fantastic.
Thank you. Gosh, we'll definitely put those links out. Thank you.
Thank you for joining us.
Thanks to all of our listeners. We'll talk to you all again really soon. More episodes to come. Bye.
Thank you.